Have you ever wondered what it's really like to live with schizophrenia? This mental disorder affects millions of people worldwide, yet it's often surrounded by confusion and misunderstanding. Today, we're going to break down everything you need to know, from its causes and symptoms to the different types and how it's treated. Stay tuned, because this could change how you see mental health forever. Schizophrenia is a chronic mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may appear as if they have lost touch with reality. This can manifest as hallucinations, like hearing voices that aren't there, delusions, which are strong beliefs that aren't based in reality, or disorganized thinking that makes it hard to follow a conversation. It typically begins in late adolescence or early adulthood, and while it's a lifelong condition, it's important to know that early diagnosis and consistent treatment can make a huge difference and greatly improve outcomes. So, what causes it? Well, schizophrenia doesn't have a single, simple cause. Researchers believe it's a complex combination of different factors. First, genetics play a role. Having a family history of schizophrenia increases the risk. Second, brain chemistry is a key factor. Imbalances in neurotransmitters, which are the brain's chemical messengers like dopamine and glutamate, are thought to be involved. Then there are environmental factors. Things like prenatal exposure to viruses, malnutrition before birth, or growing up in a high-stress environment can also contribute. Finally, substance use, particularly certain drugs, can trigger or worsen symptoms in people who are already vulnerable. Basically, it's a complex interaction of biology, environment, and lifestyle. There's no single culprit. The symptoms of schizophrenia generally fall into three main categories. First, we have positive symptoms. These aren't positive in a good way. They refer to psychotic behaviors not seen in healthy people. This includes hallucinations, delusions, and disorganized speech. Next are the negative symptoms. These involve disruptions to normal emotions and behaviors. This might look like a lack of motivation, reduced emotional expression, often called a flat effect, and social withdrawal. Finally, there are cognitive symptoms. These affect memory and thinking abilities. Someone might have poor executive function, which is the ability to plan and make decisions, trouble focusing, or difficulty understanding and using information. These symptoms vary in severity from person to person and may come and go, making schizophrenia a highly individualized experience. Now let's break down the types of schizophrenia, which help doctors understand the condition better and tailor treatment. First is paranoid schizophrenia, which is characterized mainly by delusions and hallucinations, often involving paranoia or a fear of being persecuted. Then there's disorganized schizophrenia, marked by disorganized speech, erratic behavior, and flat or inappropriate emotional responses. Catatonic schizophrenia involves severe disturbances in movement. This can range from rigid, unmoving postures and a lack of speech to repetitive, purposeless movements. Undifferentiated schizophrenia is a term used when symptoms do not clearly fit into one specific type, but include a mix of behaviors from the other categories. And finally, residual schizophrenia is diagnosed when the more prominent psychotic symptoms have subsided, but some negative symptoms, like social withdrawal or flat affect, remain. While the latest diagnostic manual, the DSM-5, no longer officially separates these subtypes, understanding them helps illustrate the wide variety of experiences people with schizophrenia can have. So, how is schizophrenia diagnosed and treated? It's diagnosed through a thorough clinical evaluation. This includes reviewing a person's medical history, conducting mental status exams, and ruling out other medical conditions. Sometimes, brain imaging like an MRI might be used to rule out other problems. Treatment usually involves a combination of approaches. Antipsychotic medications are often prescribed to help manage hallucinations and delusions. Psychotherapy, like cognitive behavioral therapy or CBT, is crucial for developing coping skills and improving social function. And supportive care, which includes things like occupational therapy, social support groups, and family education, is essential for building a stable life. Early intervention is absolutely critical. With proper, consistent treatment, people with schizophrenia can lead fulfilling and productive lives. Living with schizophrenia is undoubtedly challenging, but it is not a hopeless situation. Strong support systems, structured daily routines, ongoing therapy, and community programs can significantly improve a person's quality of life. It's so important that we all work together to fight the stigma surrounding this condition. Schizophrenia is a medical condition, just like diabetes or heart disease. It is not a character flaw or a moral failing. Spreading awareness and promoting understanding can make a world of difference for patients and their families as they navigate daily challenges. So, to recap, schizophrenia is a complex mental disorder with varied symptoms and types, influenced by a mix of genetics, brain chemistry, and environmental factors. Early diagnosis, proper treatment, and a strong support network are the keys to managing the condition effectively. If this video helped you understand schizophrenia a little better, please hit that like button, subscribe for more mental health content, and share this video to help spread awareness. And let me know in the comments below, what surprised you most about schizophrenia? Thanks for watching.